innovative work in the field of aphasia. And I'm just so pleased to have her come here and speak on this really important issue for caregivers and the people they care for. Thank you, Roberta.
Thanks, Susan.
If I could just say to folks, if you have questions, please put them in the chat for us whenever they come up. And Roberta will probably mostly speak to them at the end, putting them together, but don't let yourself forget what you wanted to ask. Put it in the chat as soon as you think of it.
Thanks for saying that, Susan. I would have forgotten to say that even though you told me to. That's perfect. All right. So what I thought we would do to begin with is I'm going to start with some kind of basic information, some foundations about communication and communication barriers. And then hopefully at the end, we're going to have time for kind of questions and answers, and I'll look at those chat questions and we'll answer that. So let's just kind of dive in here. So helpful tips for reducing language barriers caused by communication challenges. And that's a mouthful, no pun intended. And it's also very complicated. Communication is super complicated. So that may be one of the first take-home messages today. Let's see, I want to see if I can advance my slides. Here we go. So I'm from the Aphasia Center of California, and we are a nonprofit organization, and I'll talk a little bit about us at the end. We've been around now 27 years, founded 27 years ago, 1996. So what is communication? Well, it seems like we all take it for granted, but super important. So here I'm going to start with a dictionary definition. It's the act or process of using words, sounds, signs, or behaviors, so not just words, sometimes we think it's just words, to express or exchange information or to express your ideas, your thoughts, your feelings to someone else. So that's really what communication is all about. And maybe let's do this. When someone speaks a language, we usually consider 4 main areas or abilities: speaking, understanding and listening, and you're going to hear these multiple times today, reading and writing. And those we call modalities, basically different types of communication. And they can be very different depending on different kinds of disorders or different kinds of impact on the brain. Can cause a problem in speaking, but not in writing, or can cause a problem in understanding, but not in reading. So they can vary. They don't all flock together. Okay. So communication really is a process. Like I said, I'm going to say it another way, same information in a different way, by which people send messages or exchange ideas or thoughts with one another, and it can be in a verbal or a non-verbal manner. So here's this little diagram here, this little pictograph that shows 2 people trying to send a message, one person to the other. So the S for speaker or sender sends a message to the receiver, and then depending on what was communicated, the receiver gives some feedback or maybe sends another message back to the sender. And in a conversation, that can happen over and over and over again, right? Where you have someone giving a message and someone then giving feedback or sending another message, changing the topic, whatever. So here's the same thing, but in a different kind of way, a different diagram. So what I want to get across is that it's kind of a circular event. Communication. You don't just send a message and then nothing happens. You really want to see the reaction or the response from the person you're sending the message to. So there's exchange of information. And what can be frustrating is when you're sending a message, right, and you don't get that feedback from the other person. You're not sure if they understood. You're not sure how they should respond. And so that's what we're going to focus on today. Communication, so keep in mind that there's more to it. So here I'm saying it again, than speaking, understanding, reading, and writing. There's also other ways to communicate. And for many of the clients or family members that you're with, you really want to think of these alternative ways sometimes are going to be the most effective ways for communication when areas of language are disordered. So if someone's having trouble speaking, understanding, reading, and writing, you have to think about workarounds. You have to think about other ways that someone might be able to communicate. So communication challenges can affect one or more of those areas of language, like I said, and there's no rules to this. It really depends what area of the brain is affected and why the brain is being affected. And we'll get more into that as well. So how you attempt to communicate with each person depends on what is causing the language barrier and what components of language are affected. And Susan had shared some questions ahead of time. And when I read through some of those questions, I saw that all of you have some, there are differences in the types of people that you're trying to communicate with. And the attempts or what kind of workarounds you're going to choose could be very different. And if you have more than one client, each client is going to be very individualized. So today I'll be talking about different language barriers that you may encounter and ways to work around those language barriers. And I'm not going to have all the answers. I think what I'm hoping to do is kind of give you maybe a framework where you can start doing some trial and error to figure out what works for the specific person that you're communicating with. All right, so here we go. Here again, the idea that you send a message, someone receives the message. Ideally, you verify that they received the message correctly, and then there's a reply to the message, and then that whole sequence starts over. So those little diagrams, this is more now in writing, right? So that same kind of circular thing. All right, so what are ways that we can send a message? These are some ways, and I bet there are others, and maybe we can talk about that in the Q&A. The obvious one is speaking. That's what I'm doing right now. If you saw my whole body, you would see I'm gesturing too, but you can't see me using my hands, but I am below the screen. But I could be writing to you. That's a way of sending a message. I could be texting on my phone. Obviously, people are doing a lot of texting these days. That's a way of sending a message. I said gesturing. I could talk about if someone's thirsty and use a gesture to drink, or are you tired, using a gesture to sleep. I could take a pad of paper and I could draw a picture that might communicate what I want, the way I'm going to send a message to you. So I recommend that people always have a pad of paper and a good either felt tip pen or a pen that's easy to see nearby, because you are going to have to start doing some trial and error if the speaking or writing modalities aren't working the way you'd hope. Emojis, using emojis is a way of communicating these days. Showing photographs, right, to someone to communicate something. And then if we go back into kind of former times, I don't know how many people use Morse code anymore, but that's a way of communicating. That was a code, a communication code. And I'm sure there are others that we could come up with, but I ran out of room on the slide. All right, so those are ways of sending a message. The important thing is here, they can all be successful in communication. And that's the bottom line, right? Don't worry so much about the how you're going to get the communication. You want to get to the communication. All right, so then let's talk about a barrier to sending a message. So in this little diagram, the sender, right, says, "Hi, Alfred, how is your sister?" And he's saying, I guess maybe it's a she, not sure, well, whoever it is in a very noisy environment. And I bet we've all been in a noisy environment and trying to communicate. And the receiver, the person that is talking to, I guess this is Alfred over here, says, "Oh, I'm fine. I went kayaking today." Okay, that is not what that was being asked. "Hi, Alfred, how's your sister?" And this person answers, "Oh, I'm fine. I went kayaking today." The problem was that it was so noisy that the message was distorted, right? And the feedback didn't follow. And this is an example of noise, and noise is kind of the universal negative for communication. If you can do one thing in an environment, I would say get into a quiet environment whenever you're going to be communicating with someone who has some kind of a communication disorder. That's like number one, because every single communication challenge is made worse by noise. for all of us, right? If you're in a noisy restaurant, you're trying to have a conversation with someone, it's really, really difficult. So the noise in this diagram, it says here, could be any barrier to communication. It's not limited to audible sounds. For some people, we're talking about auditory noise, visual distractions can also be a barrier to communication. So if someone's in an environment where there's a lot going on and people are coming in and out of the room, maybe they're doing it quietly, but they're visible to the person who has maybe the brain injury or brain issues going on. They may be distracted trying to follow what's going on in their visual environment, and that causes problems with communication. So also trying to decrease the visual distractions. So if you're in a room where it's quiet without visual distractions, you're at least setting the stage for more success. We don't know if you're going to have the success, but at least it won't be a barrier to it. Okay, so let's talk about hearing loss, because a lot of us as we're getting older are going to have hearing loss or already have hearing loss, and that can lead to a language barrier, right? That's in the inner ear or the external part of the ear. It's not really up in the cortical area of the brain, but it leads to a language barrier too. So when someone has difficulty hearing, there are some techniques that you can use to help hearing and comprehension. I think someone had a question about how do I know if it's hearing or if it's in the brain, more auditory comprehension. And so one of the things is talk in that quiet environment, right? We're back to that quiet environment. Try to remove all of that auditory distraction, all that noise. So that can be hard if you're in, maybe you're working in a skilled nursing facility, or you're working somewhere in a hospital where there's a lot of other stuff going on. The more that you can reduce that noise, the better for someone with a hearing loss. If now you don't want to be yelling at the top of your lungs, but if you can increase your volume by getting closer to that person. So rather than trying to talk to them from across the room or from another room in the house, if you can go where they are and get closer and maybe raise your voice a little bit more than you would normally do, if that helps them understand, then that could start to diagnose, I'm using that in quotes, a hearing loss. At least it can make the communication better. If they wear a hearing aid, and lots of us do, make sure the battery is functioning, because a hearing aid that's in someone's ear with a battery that isn't working is actually making it harder for them to hear, because you've plugged up their ear with a hearing aid that isn't functional. So I can talk about, if people have questions about how to kind of test for a hearing aid that's working, it's pretty easy. But that you want to make sure that the person's hearing aid or aids are functioning. The other thing is, if the person has a hearing loss and maybe you're in an environment where you can't reduce the noise or you can't really get closer to them or whatever, if you write down information, assuming that they speak English and assuming that they're able to read and write, so I'm talking about someone with a hearing loss, that shouldn't prevent those things. If you write the information to them, they should be able to read it and then answer it, if it's only a hearing loss. So if someone just has that hearing loss, writing down information, exchanging should be helpful. So hopefully we can come back to that in the Q&A later, questions and answers. All right, so now we're going to reverse it a little bit, and maybe that person has speech that's very hard for you to understand, right? So they're talking and they're not very intelligible. Their speech might be slurred. It might be very low volume. It might be a combination of all of that. So when someone has difficulty speaking or has speech that is hard to understand, there are some techniques that can help. All right, and there are some disorders where only speech is involved. I say only, that's a big thing, but the rest of language, so we talked about speaking and understanding and reading and writing as parts of language at the beginning of this talk. So if only the speech is involved and understanding and reading and writing are okay, then we can use those as some workarounds. So we're back, we always start with a quiet environment. Someone having trouble, if you're having trouble understanding their speech and there's noise, that is a barrier right there. The person can, now here's something that just almost happens automatically. when you're talking to someone who's hard to understand, sometimes what happens is those of us who are trying to have that conversation think that if we talk louder to them, it's going to help them produce more clear speech. And that is not true, right? You don't want to shout at someone who has problems with their speech. So there's no need to change the volume or style of your speech, although that might be almost, seems like it's something that's kind of innate for some of us. So just check that, make sure you're not doing that. If the person is very hard to understand, then we're back to a workaround. See if they can write or use a device to let you know what they want to say. So I'm trying to think of some disorders that you might know. So earlier on, there are some types, for example, of multiple sclerosis, or it could be ALS, where the speech may be affected first and writing is still pretty intact. And that would be a way that you could, try to have better communication. If you can't understand them, they could use that workaround and you could help them, give that suggestion. Okay. All right, so now I'm to a disorder that I know a lot about, and I could probably talk for too many hours about this, but I won't. So we're going to talk about something you may not have heard of, although it has been in the news more lately because some famous people have been talking about it, and that's aphasia. So that's a language loss due to stroke or other brain damage, and that can lead to a language barrier. I'm going to talk about some of the techniques we use with aphasia. They may apply to other disorders depending on how much of the brain is impacted by those other disorders. And that's always kind of the caveat. What I'm going to say is the more brain that's involved, the harder it becomes. And the more creative you can get with your trying to see what helps communication the most. And even if someone can't necessarily contribute in the way they used to, and actually Susan was saying this before we started, it's important to include them and to keep communicating with people. People need that connection. And communication can sometimes be singing a song together. It could be a lot of different ways of connecting with someone. All right, but to aphasia. Most aphasia is caused by a stroke. Okay, and it causes a language barrier by affecting all areas of language, those 4 areas, but to differing degrees. And there's a lot of different kinds of aphasia. None of this is simple. So it would be nice if there was one type of aphasia, but there's probably at least 10 types of aphasia, depending on where in the brain the stroke has occurred. So you guys could probably chant this with me. It's going to affect speaking, understanding, reading, and writing when you have aphasia, but sometimes not so much in some areas and more in other areas. Okay, so it's caused by usually a stroke. Like I said, about 1/3 of all people who have strokes have some amount of aphasia. That's quite a bit. For a disorder that hardly anyone has heard of, it's actually pretty common. More than 2 million people in the US have some amount of aphasia. But other brain damage, such as the brain tumor, a traumatic brain injury, or a gunshot wound, can also cause aphasia. Some famous people like Gabby Giffords, who was the former representative in Arizona who had a gunshot wound to her head. She has aphasia. She's stayed in the public eye, and I admire her for that. And we'll talk about some other ways that you can get aphasia. And one of them is primary progressive aphasia. And some of you had some questions about that. That's a progressive disorder. It starts with mainly language, as a language disorder. So it looks more like a stroke-related aphasia, although it's progressive. It starts gradually. A stroke happens suddenly. This is a progressive disorder. So it starts with the aphasia, but over time, and everybody's a little bit different with how quickly that happens, it eventually includes other cognitive deficits as other areas of the brain are affected by the progressive disease. So again, there's not one way. It's not like everyone with primary progressive aphasia is going to have one way of communicating. It takes that assessment and that trial and error. Okay, something that aphasia from a stroke does not have. Aphasia from a single stroke does not and I guess I should put typically, but most of the time it doesn't affect intelligence or memory. It isn't dementia. And we'll make that distinction, and I'll talk, especially during the questions and answers, more about dementia and how that can have an aphasia as part of it, but it's not total. Aphasia also doesn't affect muscle strength. Some people think, oh, they're having trouble moving their mouth, and if we just made their mouth stronger, they would be able to talk more. Aphasia is a language problem. It's not a musculature coordination problem. It's a language problem. So kind of giving you there. And I already gave you the 2 million people in the United States have aphasia. That's actually twice as many people as was previously noted in the media. So there are a lot of people out there with it. Okay, let's keep going. So thinking about all of our days today, I'm thinking about my day today. You think about your day. What percentage of the day did you either speak to someone, listen to someone or something, read something, or write something? So if you're working still, and actually with texting and with our phones kind of attached to us these days, we're probably doing a lot of that. The most of the time we're awake. So for me, since I've been awake today, I would say about 90% of my day has been spent in either speaking to someone, listening to someone, reading something, or writing something. So communication is really important. And even if you're not working, it's important just to stay, as we said, connected to other people, connected to your community, all of that. So how would your life be impacted if you couldn't do those things? So I'm sensing that most of you are working with people who are having those communication disorders, so you know firsthand how much of their life is impacted. And so let's see if we can give you some strategies. All right, so here are the challenges. They come in different severities and types. No two people are alike, okay? And determining what works for each person takes some experience. It takes very keen observation, and it frequently takes trial and error. So I'm going to give you some pointers, but it's not a recipe. Okay, you're going to have to kind of punt. I also want to say that less can be more. You don't necessarily want to use all the strategies that I'm going to talk about today. Use the techniques that best suit that person you're with and the situation. And that's where the trial and error and the keen observation come in. Okay, so a language challenge or a language barrier can be similar to your native language suddenly becoming a foreign language. And most of us have been in that situation, either with people that we're talking to in our own communities that don't speak the language we speak, or if we travel. And so think about when you were in that situation. So we're taking it away from someone that has a brain disorder, and just where there's a language barrier, what did you do to be able to communicate? So some of those things that you do with people that don't speak your language will also work with someone that has a communication challenge. So these techniques should work or help anyone who know more than they can say. So someone that has something that they want to communicate, or something that you are hoping they'll understand, but they're having trouble expressing it or understanding it. So this includes some people who speak English as a second language, and some people with dementia, developmental disorders, or traumatic brain injury. Okay, all right. So here's our foundation for successful communication. We talked about the noise and the visual distractions. Avoid environmental distractions. Try to reduce them. However, you might take the person into a different environment, into a different room, close the door, turn off the TV, make sure the radio isn't going, all of that. Allow more time for the person to respond. Most people benefit from having extra time. Time is a friend. And then become that keen observer, looking for subtle changes in the person's face or body when you're asking or trying a different technique, seeing if that seems to engage them more. So a lot of it is you observing and seeing what's working. Okay, so here are the 4 steps that I'm going to talk about. First of all, this goes without saying, I'm sure all of you are already doing this, but you always want to treat whoever you're talking with respectfully. And we'll talk a little bit more about that. You want to be able to send information. So we're back to those little diagrams where there's someone sending information. So we want to figure out how to do that effectively. We want to figure out how to, for that person to receive the information and understand or get that input effectively. And we want to be able to verify that we actually understood each other. Because sometimes you think you're understanding and you're not. And if you keep going on the wrong path, you're going to end up in the wrong place. So verifying can be really, really important. All right. So how are you treating the person respectfully? What do I mean by that? When possible, interact directly with the person, not their surrogates. Okay, so if the person is going, hopefully this is happening in healthcare today, although I'm not sure it is all the time. Hopefully the doctors and the nurses and the therapists are trying to have that communication directly with the client or the patient, not with necessarily with the wife or the husband or the daughter or the son. And that may not always be possible, but then the health whoever should explain to the person, you know, I'm having some trouble understanding, is it okay if I talk to your family member to get approval and to let them know that that's going to happen, not just to assume and go to that other party first, okay? You always want to speak naturally with normal loudness, unless you know the person has a hearing loss, and increasing your loudness helps. It's not going to help pretty much anyone else by talking too loudly. And you want to use an adult tone of voice. That's where sometimes that instinct that we're not even aware of can come in, where we kind of are using almost like baby talk, kind of that, oh, how are we doing today? That kind of thing. You don't want to be doing that with an adult. None of us would want to be talked to that way. And so you want to see if you can keep speaking naturally. You want to acknowledge if the person is frustrated and is afraid of being thought of as stupid, because often if we're having trouble communicating with someone thinks that we're less than, right? That we're not competent. And so sometimes it's just saying something like, I know that you know more than you can say. You know, I know that you know more than you can say. And that can be enough to put that person at ease, like, okay, they realize that I do know more than I can say. And that levels that kind of relationship there. It helps the communication. So that's the treating the person respectfully. I'm guessing that most of us do this just kind of from the get-go. All right, so let's talk about ways of sending information. So you're the person that's trying to send information to your partner, your communication partner, if that's a client, a patient, a family member that has a communication barrier. Probably what's going to help is using short, simple sentences, not baby talk, but just shorten and simplify some of the vocabulary. You don't want to be talking with 3 or 4 syllable words, but you want to maybe shorten it so that if they're having auditory comprehension problems, they don't have to listen to a very lengthy. What I'm doing right now, the way I'm speaking, would not be good for someone with a language disorder. I'm speaking too quickly. I'm speaking in long sentences. I'm not pausing. I'm doing everything wrong for that type of a scenario, right? So don't do what I'm doing now. And using some expression in your voice. So I'm trying to use some intonation, and sometimes intonation can be helpful, the right intonation. You need to assess with each person. Should you use open-ended questions like, how are you feeling today would be an open-ended question, or maybe asking it in a way that gives some limited options. Are you feeling hungry? That's a yes, no, and I'll show you how you can kind of set that up. Or maybe you write on the pad of paper 3 different possibilities if you know the person well enough that if they can read some key words, then they can choose the one that they want, right? So the open-ended question is the most challenging for someone with a language disorder. The limited option, the yes, no, is probably the least complicated if you ask it with just kind of one step in there, and giving some limited choices is in between. You may want to ask questions that can be answered by pointing or gesturing. So when I said I might write something on a pad of paper, then I'm going to put the pad of paper down where the person can see it. I'm going to think about if they have trouble seeing out of one side of their eye or the other and put it in the right place. And then I might say, can you show me? And use my hand to the paper what you'd like to eat for breakfast today. Do you want eggs? Do you want cereal? Do you want toast? And maybe those would be the 3 things I would write down. I might write them as I'm saying them. I might see if they can point to the one that they want. Now, maybe writing the words is not, it's too challenging. So what could I do? I could use some photographs of the eggs. I could use a photograph of eggs, cereal, toast, and ask them that way with the word underneath. So we're starting to try to figure out what's going to help them the most. Okay. All right. Continuing with sending information. As you are talking, add communication tools. So that's what I just kind of gave some examples. You might use some gestures that the person can easily understand. We did that before. Are you thirsty? I might, if it might work for someone, again, I'm going to try these things out a little bit. I might write the word thirsty, and I might use the gesture for drinking. And then I'm going to have a yes or no, because sometimes people can say yes or no. Sometimes they can point to yes or no. Sometimes they can learn a thumbs up or a thumbs down. Everybody's going to be different. And, so that's where the trial and error comes in. Writing keywords can be really helpful to some people. And you would use a main idea in bold print. You're not writing keywords of an entire sentence. The keywords would might be just a word or a couple of words at a time. You can use those pictures or photos. So if I traveled tomorrow to a country, let's say I go to Japan and I don't speak Japanese, I would want to have something with me to communicate because there's going to be a language barrier, and I might use my phone or something else to bring up some photos or some pictures or a map where then I can communicate with that person who speaks Japanese and I'm speaking English, but we're using some tools, right? All right, so let's give you some examples. So maybe you're trying to find out whether the person is more interested in taking a shower or a bath. Or wants a shave or nails. There's 4 pictures here. That may work for some people. That may be too many pictures for someone else. So if it's too many pictures, you might go down to 2, right? If they're having a choice. And here they're already labeled with the writing, and you would slowly say, today do you, if there is a choice. So if you would obviously set this up. These are just kind of odd examples I'm showing, but I'm showing you how you can use pictographs to get some information exchanged with someone. Here's a way of doing time, which is kind of a hard abstract concept, right? So maybe a doctor, a healthcare professional, a physical therapist might want to know how long someone's been having a symptom for. Have you had this pain for like a minute or an hour, a day, a week, a month, a year? There's a lot of pictures on here, so you might decrease the number, but you can get things across with a pictograph or a drawing. So that can be a workaround. Maybe you want to find out if they're having trouble in a relationship, if there's some type of abuse going on that you're worried about. And there are pictographs available, and actually the Aphasia Institute in Toronto, and I'll give that information to Susan and the website that they have these free to download, some of these pictographs. But you can get, for someone that's having trouble communicating, you might be able to talk about something very important and also very emotional. Okay, certain services. Do you need help with something else? Okay, so these are just examples. Almost anything can be made into a pictograph with some thinking. Okay, so that's the sending the information. Now the person has to receive it and process it, and then you want to have a way for them to reply, right? And it may not be verbal, it may not be speech. So asking those yes/no questions and making sure that the person has a way to respond is really important. And we'll talk a little more about that as we go. You always want to ask one thing at a time if someone's having a lot of trouble communicating. So what you don't want to do is you don't want to say, you know, when we went to the doctor yesterday, what did you think about that nurse? Did you like her? Oh my, that's a lot, right? So you would ask it one at a time. You might be able to bring up on a computer maybe the clinic that you went to, and then you might write nurse, and then you might say, did you like her or not? Okay, something like that. You might want to ask the person to give clues to you. You might have to ask them to give the clues. Can you gesture it? Can you show me? Can you point to something? And maybe you have some pictures or you have a pad and you've written some keywords. You might have to help them kind of initiate that. Don't expect them to initiate it. They're going to need some assistance in moving forward with that. Give that person extra time. We talked about that. It's here again. So here's some ways to give someone some opportunities to respond. So if you're asking yes/no questions, sometimes having a card in front of them where they can point to the yes or the no, or maybe it isn't a yes or no, maybe it's like a, right? So you give them something where they can be in between. So it's vertical, so that's a little easier for people that have visual problems, so that it's not one side or the other, so that they can point to a yes or a no. A number line can be used in a lot of ways. This is a reversal of, I think in hospitals, they have a pain scale that has reversed 10 to 1, but we use it a lot with people with aphasia because they can talk about all kinds of things. How much did they like the restaurant they went to, or the meal that they ate, or did they like their aide? Did they like the movie? Did they want to go to the park, or, you know, or whatever it is. A number line can be really helpful. So you might want to have one of those. You just can write it down on a piece of paper. You don't have to have a special one. You might want to get at someone's feelings and use pictographs if you're asking them how they're feeling, and they can point to which of those or something else, and that may be too many pictures on the page. So then, assuming that you get them, there's a response, and maybe it's just their facial expression changes and you get a sense of what it may be, and then you might write it down, or you might get them to start drawing a picture and then you continue it. But then you want to verify it. Like, are you right, or are you going down the wrong path? So make sure you really understand. So one way of doing that is to summarize what you know slowly and clearly, so that you get to it. So you might say, so let me make sure I understand. And then you kind of review what they've said. Again, using some short sentences, maybe using some keywords on the pad, maybe using some gestures. So add those gestures or keywords if necessary. So this is I mentioned the Aphasia Institute in Toronto, Canada. They kind of have collapsed or incorporated, maybe is a better word, all of these different tools into what they call their toolkit, and they do some training for healthcare professionals. So this is like an old-fashioned doctor's bag. So these are just, if we look down here, you know, using gestures, using yes, no, asking for clues, simplifying language, showing pictures, using drawings, using writing, using paper and a marker. Those are really the workarounds, and each person is going to be different with which of those might be successful, and it may change. It may start, if someone has a progressive disorder, you might be able to use certain techniques for a while, and then you find that something's dropping out, and so you're going to have to change. I would also say that you might be able to get a good evaluation done by an experienced speech-language pathologist that could assess someone for some of these. Not every speech pathologist is going to be able to do this, but that may at least give you some input as to which techniques might be the best to try. So maybe we can talk about that more. So I want to try to play this. Let's see if I'm successful. So I'm going to show you 2 video clips. The first one is kind of painful to watch. It is for me. It's a man with aphasia talking to a neurology resident. And the doctor, the resident, has had no training in how to communicate. So I just want you to watch it for a while and then I'll get off of it. So think about Jerry's the name of the person with aphasia, and think about what we know about Jerry. So let's see if I can get this to work.
But let's now look at what
Hear
happens
it?
when Jerry is talking with a conversation partner who has had no special training. We will see Jerry being interviewed by a young doctor who volunteered to help the Aphasia Center develop their training programs.
Can you tell me your age? How old are you? It's okay. Just for my sake, to get a feel of what you can understand. Do you think that you can understand everything that I say? How long has it been now that you've had difficulty?
I'm going to stop it there. The doctor isn't really able to get very much more information from Jerry. And he hasn't had any training, so we're not going to be mad at the doctor, although that might look familiar to some of you with communication with a family member or a client. But let's redeem the doctor and let's show the after clip. And this is after he's had some training and some of the things I've talked about of how to get messages in, how to get receive the information, how to verify it. So let's now look at Jerry and see what you think about Jerry. This was a week later. Jerry hasn't had any therapy in between here, okay?
To highlight the difference training can make, here once again is Jerry and the same doctor after the doctor had participated in the training program.
How old are you, Jerry? You're, let me try and remember, are you more than 60 years old?
He writes the number 60.
More or down? More. You are 60?
Yeah.
So, Jerry, you're 60 years old.
He verified
no more,
it.
no less.
Yeah.
Okay. Some questions I asked you last time didn't work very well. Do you remember?
Yeah.
It didn't work well. So this time it's going to work. Okay. Something happened to you years ago to cause the communication problem.
Yeah.
He writes the word stroke.
Was it a stroke?
Yeah.
You had a stroke. So your right side doesn't work very well. Do you write with that hand, with the right hand, I see. All right. You live here
Yeah.
Toronto? in Toronto?
Pointing to the binder that has a map in it.
You know this book better than I do, then.
Points right to where
But now
Yeah.
you live in Toronto.
Yeah.
it's going to verify. He writes Toronto.
Do you live in North York? West.
Yeah.
So you live west
Writes west.
of Toronto?
Yeah.
Are we talking about Etobicoke?
Yeah.
Okay. That's where I'm from too.
Yeah.
Yes.
Okay, so that's quite a difference in Jerry, wouldn't you say? And so if we had only seen that first clip of Jerry with the doctor who wasn't trained, we might have thought that Jerry was not capable of much communication. But when you have a trained communication partner, then you can see that he's pretty with it, right? I mean, he's an intelligent man who knows the information. He knows more than he can say when he's with the right partner who's willing to use some of those other strategies. All of a sudden, that information can be shared and they can have a conversation about it. The doctor was doing kind of a medical history, right? But you could see how that could work, hopefully, in other situations. It might be about a TV show that they watched or, the restaurant that they went to. So communication partner training and a communication partner that's willing to be that keen observer, to use some trial and error, to use some other strategies can be huge, make a huge difference for someone. So I'm going to just have a few more slides and then we'll answer some questions. So I mentioned English as a second language. You may be working with some people that have that in addition to some brain disorder. So when someone has difficulty using language due to English being their second language, remember that the best thing is to have an interpreter that can help you with interpretation. That's better than using a family member or someone else to be the interpreter. You really want to have someone who's competent in both languages. But if that's not possible, consider some of the strategies we've talked with today. Just like if you traveled overseas, you're still intelligent when you travel overseas, but you have a language barrier, so you have to do some workarounds. If someone has dementia or traumatic brain injury or developmental delay, we know that can lead to a language barrier. So when someone has difficulty using language due to dementia or other more diffuse or widespread brain damage, there are some techniques that you can use. It's mainly the ones we talked about, and it depends on the severity of the dementia and how many different components of cognition are involved. And that's where it gets really tricky and challenging. It's not necessarily impossible, but if it is super challenging, just the attempt or finding the things that you can do together that bring that is positive for someone is going to be helpful. My father had dementia for many years, and toward the end, we would sing together. Neither one of us had very good voices, but we really enjoyed that time together, and that was one way that we communicated. So just share that. So consider the strategies we've discussed. Each person with dementia or with traumatic brain injury is going to be different, just like each person with aphasia is different. And decrease those distractions. That's always going to help. It can't hurt. Very important, both the auditory and the visual. So I'm going to end with two slides of the Aphasia Center of California. Well, before the pandemic, we were at the downtown Oakland Senior Center and in a Menlo Park Little House as our program sites. We've been on Zoom ever since the pandemic for 3.5 years. It's actually working out better than we thought it would. So we have a lot of different groups. We were the first independent aphasia center in the United States, founded in '96. We're a not-for-profit. And our mission is to enhance communication skills, quality of life, and overall well-being for all those affected by aphasia. So we'll go to questions. This is just contact information, the phone number, our website. We have a Facebook page. We also have Instagram. So I'm going to stop sharing so we can open for some questions, and I'll look at the chat. And I see there's one question in the chat. How we can test the hearing aids. Okay, so to find out if a battery is still working, first of all, you want to take the hearing aid out of the person's ear, whether it's in, whatever, there's a lot of different hearing aids these days. But if you put the hearing aid in your hand and you cup it like this, right? So you're kind of sealing that hearing aid in with your hands, you should hear a little kind of buzzing or high-pitched sound coming from the hearing aid, because you're making it have feedback that it shouldn't normally have. So you should be able to hear that kind of sound coming out of it. And if you don't hear that little sound coming out of the hearing aid, it probably means the battery is dead. It could be something else wrong with the hearing aid, but start with the battery. So then I would replace the battery and try that again. And if then you hear the little sound, then you know that, okay, battery's working, then you can reinsert to the person's ear, and hopefully that'll help it. Okay, so that's that question.
Let me ask you, Roberta, if the hearing aid is by accident turned off, can that happen?
Oh, sure. Yeah. So if someone turned it off, so yeah, you'd want to make sure that it's turned on first. So thank you, Susan. Absolutely. And all the hearing aids are different these days. And there's, so hopefully if the person, got, it's hard because some of you are working with people that aren't going to retain that information, but hopefully there's someone in the environment that knows how to turn the hearing aids on and off. And those hearing aid batteries don't last very long for a lot of those hearing aids. So, you might, these days you might have to Google the hearing aid and look up how to turn it on or off and go through that process, make sure it's on, check for the feedback. If you don't get the feedback, put a new battery in, or some hearing aids, you just plug them in at night. Maybe it needs to be plugged in to recharge if it has a rechargeable battery. Yeah, you guys, thank goodness for the internet. It teaches us a lot of stuff, so.
One other thing about it that you said, but just to repeat, if the hearing aid is not working because the battery is dead or it's turned off, then it makes it even harder to hear.
Right. You don't want to put it back in their ear. It's not, plug. It's like an earplug.
That's just right. It's like somebody stuck in, I can't hear a thing. Yeah.
Yeah. So, okay. So I've seen some more chat. Is there a website? Okay. So those pictographs. So I'm going to share with Susan. So I can give you the website now, and then I think she's going to write something up as well. So it's the Aphasia Institute's website, and they're in Canada. You learned they're in Toronto, I think, from that interaction with the person with aphasia and the doctor. And of course, I'm trying to write on my pad and it isn't very dark, but the website is aphasia.ca for Canada, not California, Canada. So aphasia.ca is the Aphasia Institute website. And in order to get those pictographs, you have to become a member, which is free, of their community hub. And once you join, I think you just give them your email. You won't get like inundated with advertising. Then you can look for, I think they call them participants. And then you can set up an account and get some of those to download. So I hope that helps.
And we will have that information in the webinar the newsletter that will come out next Wednesday. And hopefully you all get the newsletter. Lawada will double check that you're all on that list, and I will put as much information from this as I possibly can. Certainly that information will be there.
Yeah, it looks like, is it Shantae?
Yes, thank you, Roberta. Is there more information? I'm dealing with my husband who has Alzheimer's and primary progressive aphasia. And so the majority of his communication is unintelligible. Ever so often there is something that comes out very clear. Is there more, that I could perhaps access in terms of information to communicate better with him or to help others? He's in a skilled nursing facility right now. So
yeah, so the training could be challenging sometimes because there's a lot of different probably personnel working with him. But first I would say, so if you go to the Aphasia Institute's website, aphasia.ca, so the same one I just mentioned, and you join the community hub, there is training there in supported conversation, which is what I kind of gave you a very brief overview of. The training they have is meant for healthcare professionals. So it's a little bit slanted toward physicians and nurses, but there's it's free. There's no reason why you couldn't go through it and you would see some more explanation and more videos than I was able to share today. I think it sounds like you're saying that his speech in language is not very understandable, or what he's saying isn't making sense from what you're asking him. So you may want to see if there's a different way for him to express himself other than speech. And so that may be using the yes, no kind of pointing, seeing if he can gesture it, but maybe asking some yes, no questions and seeing if he can get it. I would have a pad of paper. Again, you're going to have to do a little bit of trial and error yourself, which you probably already are doing. But does he have favorite types of food?
No, he's Mikey. He's just about anything.
Okay, but I mean, so what types of questions are you most interested in asking him?
Well, it's
start
not so much just no questions, but just finding out in terms of his sometimes, you know, he doesn't answer yes or no, but he might say mm-hmm
Okay,
or
yeah,
no. He may do
that's fine,
that. And
right?
it's not, and I don't know if it's always accurate
Right, so
because
that's
of the Alzheimer's.
right, that's the verifying. So some of it might be what you want to make sure, if you can, and again, you're in a very complicated situation because there's a lot going on if he has Alzheimer's and primary progressive aphasia, but you want to make sure that he, as much as you can, is understanding what you're saying to him. And then you may be able to read, if it's getting through, you're able to read maybe his facial expressions. It may be like you're saying he's giving you some or something. So it may be slowing your own rate of speech, using some pictures, photographs are even better than pictographs a lot of times to when you're asking about something or having a conversation about something, writing a keyword. I don't know what his reading comprehension is like, but seeing what results in the best chance of him understanding. It's complicated, and you might be able, depending on, you know, what kind of, you know, there may be a speech pathologist who's trained in that skilled nursing facility that could do at least some assessment on some strategies to see if that could be helpful.
Thank you.
Yeah.
Can I ask a question here, Shante? Can you give us an example of something recently that you tried to find out from your husband?
Usually the most recent example was an incident that occurred, and I knew he was unlikely to be able to communicate what was wrong, what happened. You know, he's in a skilled nursing facility, and apparently there was some agitation and some aggression that occurred, you know, on his part, aggression towards some CNAs. And he cannot communicate to me what might have occurred to trigger that, you know.
Yeah. So
those type of things.
Yeah. And it may be that his situation with the primary progressive aphasia and the dementia may not allow him to give you the full story, but you might be able to ask, you'd have to narrow it down, see if you can take the big situation and see if you can ask one thing at a time or one thing that might trigger. The other thing is just seeing the pattern over time, what is triggering it, and working backwards from that. So I don't think that's an answer I'm giving you, but maybe just some suggestions.
Well, I think if I could say, Shante, the issue of his emotional control, if you will, you know, acting out or getting agitated is a huge part of what you try to work with communication to help, you know, to understand why he's, you know, upset. Is that accurate? That's a situation that you are dealing with your husband frequently on some level?
I wouldn't necessarily say frequently. I use the word it's unpredictable a lot, you know, so I don't know how much is just in terms of the disease itself, because there's a lot of behaviors with Alzheimer's that, you know, manifest, and you don't necessarily know why they're manifesting at those particular times. But then I have seen, you know, when he was still at home, some things that manifested that were because of what was going on in the environment, so I know that there are things that can trigger,
Right.
certain behaviors, but me not being there 24/7 at the facility, I don't know, what might have happened. But I do know from what I have seen that the people there, particularly the CNAs, I feel are not necessarily trained in the full scope of Alzheimer's and its manifestations and so on and so forth. So they don't know how to deal with it. So in not knowing how to deal with something, you could do something that triggers something.
Right. Yeah.
So I don't know what happened, and I can't get that from him,
Yeah.
so
Yeah.
yeah.
That's challenging.
Yeah.
Yeah, it may be like we talked about, it may be that something was too loud or too visually distracting, or that someone was hurrying him around, something. It could be a lot of
Mhm.
things, but hopefully
Right.
maybe there's a key person that works there that might be a good ally for you to start to unpack some of that.
Yeah.
Good luck.
Okay. Thank you.
Yeah, there's something one more in the chat. Someone said, the issue with my brother-in-law is that it is very difficult to understand what he says. He is very intelligent. He gets frustrated and starts yelling because we cannot understand what he says. However, he does not want to practice speech therapy. Any thoughts on what could be done? So I don't know what the underlying reason for his speech being hard to understand. If you're still in the call and you want to add that to the chat, that may help me. But I think you can say to him, a stroke. Okay, so and is it did they use the word aphasia, or did they use the word dysarthria? Does that either of those words sound like what he has? You're not sure. Okay, so certainly when we would talked about treating someone, acknowledging that they're intelligent, I would start there with him, because it sounds like that's really important for all of us to be considered intelligent human beings. He might do well with an aphasia group, where he starts to meet other people who have aphasia and sees and hears what they're able to do, and realizing he's not alone. That's some of what we've found over the years. That's been our focus, is with aphasia groups and what we do at the Aphasia Center. So if you want to give me a call, maybe we can figure out if he actually has aphasia or if it's some other type of speech disorder. And I'd be happy offline to kind of point you in the right direction with that. So hopefully that helps. I think those are any other questions. You're welcome. So that was a lot. I mean, the trouble was when we get to the end is there's not like one way. It's not a recipe. It's like there's a lot of ingredients. If you are a cook, right? There's a lot of ingredients, but I'm not giving you specific recipes to follow. I'm trying to say, try some things out and see, you kind of have to take it trial and error and see what works for the particular person you're communicating with. And as we were saying, make sure they know that you respect them, you acknowledge their competency, you want to communicate, find a level that you can have that communication. So Susan, I hope this was helpful for folks.
I personally, from what I see, think it was amazingly helpful. I see Karen is here, and she's my in working with caregivers here at Daybreak. What are your thoughts, Karen? Do you think that this was helpful? I mean, I certainly believe so, yeah. You're muted, my dear.
I guess we should add that to the list of communication barriers these days, being muted on Zoom.
This has been amazing, and thank you so much for your presentation. I think, approaching people with dignity first, rather than treating it like they are developmentally challenged, instead of trying to get a communication. After all, communication is really an exchange of ideas and connection. And the connection itself is so important to establish first.
Yeah, absolutely.
How do you establish that with dignity and respect, and then experiment with watching their body language, looking in their eyes, seeing if there's cognition in their eyes that says that you're close to connecting. You know, you've really opened an opportunity for us to look at and experiment with and become our own detectives about how do we move forward.
Yeah, I hope so. And it's not easy. I'm not saying it's easy.
No,
And we talk a lot at the Aphasia Center. There's a approach with aphasia. We call it the life participation approach to aphasia. And I think in the bottom line is finding things that people enjoy doing together, maybe with you. I mean, it may not be having a conversation. It may be folding laundry. It might be watching a movie. It might be sitting outside in the fresh air and looking at the flowers, whatever it is that you share together. And then, you know, you might be able to get some conversation or some communication around that, or maybe not. But in the meantime, you've had that connection like you're talking about, Karen.
Yeah.
So
yeah,
Hello?
very key.
Hello, can anybody hear me?
yep, Penny, we can hear you.
Okay, thank you. I worked with a patient that had ALS. So they had no body movement except for to be able to blink their eyes. So now you called those boards, those helpful boards, what did you call them? Participants or
Well,
what were
those
they
weren't
called?
those aren't boards, but those are the pictographs. So the different
Yes,
little
the pictog-
images.
Yes. So we made our own pictographs. And one was an alphabet board. So what we had the patient do was we had her blink once for yes and twice for no. And then we made the pictographs and we communicated with her that way. And it was very, very successful.
Yeah.
So these pictographs that you're showing us are just marvelous.
Yeah. And although ALS is a terrible disease that you wouldn't want anyone to have, it's a speech disorder and not a language disorder. So it makes it a little easier for the communication partner because the person is understanding and their reading and
Right,
writing is usually
exactly.
intact.
Mhm.
So it although terrible disorder, that's why every disorder and every situation is unique. And
Absolutely, yes.
being that detective, like Karen said, is important. So thanks for sharing that, Penny.
Oh, you're welcome.
I think, and maybe Penny and Shantae or any of you could speak to when you are able to get through and communicate with each other, how that can transform your relationship. And
Oh, mhm.
When there is an understanding, it makes all the difference in the world. I mean, you know, when I know that the question or the comment was understood and the responses, you know, lets me know that it was. It makes all the difference in the world, especially with the Alzheimer's being present. I mean, there's like these little moments in time that there's that person that you knew. You know, so it makes a lot of difference.
wow, let's end on that note.
Thank you for inviting me.
Thank you for the information shared. It's great.
Very much so.
Bye-bye.